In a country blessed with sunshine but burdened by inequality, living with albinism often means living with risk. For many, sunlight, a source of warmth and life, can be life-threatening. As we mark National Albinism Awareness Month, the focus shifts to a crucial but often overlooked public health issue, the prevention of skin cancer among people with albinism. Beyond medical science, this is about dignity, protection and the right to live without discrimination. To help us understand the science and the solutions, I'm joined by biomedical scientist and skin health expert, Dr. Judey Pretorius. Dr. Judey, thanks so much for coming onto the show.
Thank you, Hugo. It's nice to be here.
Now, let's start off with what makes the skin of people living with albinism especially vulnerable?
Well, you know, just a little bit of science behind it. I'm going to use big words and I will definitely explain it. But the terminology around it is what we call autosomal recessive genes. What this basically means, it's a mutation in the genes that supposed to produce melanin or pigment. And this comes from both the mother and the dad. And that actually means that their children now are born with albinism. And there are different types of albinism that you get. It can be subdivided, but it comes down to the fact that you get occultaceous type of albinism that affects the hair, that affects the eyes and the skin, and then ocular albinism that only affects the eyes. So the eyes, unfortunately, really suffers a lot because there's involuntary eye movement, there's vision impairment and so forth. And the skin is so much more vulnerable because melanin, for me and you that produce melanin, it's actually a protective pigment. You know, it protects us against environmental extremities. So individuals with albinism, unfortunately, don't have that type of protection. So not only are they, vulnerable to sun rays and heat and, certain environmental extremities, and vulnerable to skin cancers, but also to other inflammatory skin concerns like rosacea, for instance.
So when we look at people that live with albinism, people that live in the southern versus the northern hemisphere, for instance, the people in colder climates or conditions where there isn't so much sun throughout the year, are they less vulnerable to some of these challenges that we're talking about?
Well, I would say, if we first look in subdividing our Earth, our planet, north of the equator, people are exposed to more UVA rays. And south of the equator, people are exposed to more UVB rays, and that's where we live. So UVA rays has a tendency to penetrate much deeper into the skin, and people think that's very harmful, that's worse. But actually, UVB rays that does not really penetrate that deep into the skin is an immediate irritant to the skin. And that's why these individuals struggle with more skin cancers, tenfold higher, such as squamous skin carcinoma, etc. And it's definitely more prevalent in the sub-Saharan African countries purely because of our gene pool in certain communities is much smaller than other areas. But yes, without a doubt, we have so much more other type of environmental extremities that can be harmful, and even pollution in the atmosphere, the air, can play a huge role.
So what are some challenges that, beyond skin health, that people with living with albinism are having to deal with?
Well, I would say, if we look at the UV index during the course of the day, that's really very high, typically during 10 to 4, the exposure to sun rays is really very extreme. So they should, seek shade, they should be indoors so much more. The biggest thing that really stands out the most is the vision impairment. And individuals, around individuals with albinism should understand, listen, there's not an intellect problem, there's not a soul and a passion problem. It's merely just a skin condition and they require more protection. So unfortunately, vision impairment is a problem. So maybe children with albinism should probably sit more toward the front of a classroom, for instance, or the teachers should provide them with textbook with larger text, for instance. So there should be some, new teaching modalities that we can incorporate to break the overall stigmatism around albinism as well.
Now what we know is that much of what people living with albinism need in terms of medications or creams or even sunglasses or spectacles, for instance, come at a cost, right?
Does
the government in any way support people living with albinism?
I would say, you know, with any component that we have to deal with in South Africa, we want more, we demand more. But it would be great because things like sunscreens are very costly. And
So before we talk about more, what's currently available or catered to before we look at what else can be done?
There are certain screenings that are done annually on individuals with albinism to review their skin, whether they have certain skin expressions such as moles, and whether some of these moles, you know, increase in dimensions, etc. But this doesn't necessarily happen at all the clinics. There are also certain components where the government do subsidize certain sunscreens, but it's not really across the board, across the country. So the most cheapest advice that I like to give is to ask individuals who have albinism to at least wear protective clothing, walk around with umbrellas. If you have sunscreen, try to apply that. You know, I've indicated also before, certain creams or sunscreen contain an ingredient called zinc, which is a UV blocker. And yes, it's expensive, but in certain diaper creams, nappy creams, you find zinc. And if you apply that, although there's not a claim on that label that it's a sunscreen, the component of zinc or the ingredient of zinc will actually help reflect some of the rays back.
Dr. Judey, if we were to do a comparison of an individual living with albinism who doesn't use sunscreen versus one who does use the right sort of sunscreen, if we were to look at them, same individuals over a number of years, just how much protection are they getting?
Well, I would say, you know, if individuals wear the sunscreen, they you know, increase or decrease their risk of getting certain skin conditions, such as, we call it solar lentigens, some of the less expressive type of concerns, and the most worst would definitely be squamous cell carcinoma, the skin cancer. But the fact of the matter is, even you and me, that you and I produce pigment. Even the two of us have to apply sunscreen. Even the two of us have to seek shade and even walk around with umbrella to protect ourselves against the harshness of UV rays. And it's not only UV rays that comes from the sun, it's even the UV rays that reflects from our computer screens, our laptops and our cell phones. So there's so much that we need to do to protect our human skin. And that's just so much more amplified when it comes to individuals with albinism. And that's why probably the cheapest way for individuals, especially in certain rural communities, would be protective clothing and to stay out of the sun during the higher UV index times of 10 o'clock in the morning to 4 o'clock in the afternoon.
Now, as we wrap the conversation, how do we move from awareness to concrete policy and healthcare support for people living with albinism?
You know, I say we live in a time where we celebrate inclusiveness and there's a drive to inclusiveness. So in other words, albinism is not a genetic disorder. I'd rather like to use the word, it's a genetic finding, it's a genetic condition, it's a genetic difference. We should celebrate the uniqueness of human skin, the significance of human skin. We should celebrate talent, and we definitely need to drive things like anti-stigmatism campaigns, without a doubt.
All right, that's where we're going to leave the conversation. Dr. Judey, appreciate your time. Thank you so much for speaking to us. I was joined by biomedical scientist Dr. Judey, and we were talking around albinism and the need for people living with albinism to ensure that they get as much sunscreen as possible in order to prevent the various cancers that occur.